Hello, I'm Dr. True Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University with a joint faculty appointment at Ross University School of Medicine. And being that I'm a newly minted faculty member of Ross University, I was a little bit more interested in understanding what is going on in the island of Barbados. After all, the main campus is located in the country, island nation of Barbados, which is part of the Caribbean islands. This is a small country, not too many people, and as of now, I wanted to look at the number of COVID deaths and the percentage of individuals that have actually taken the vaccination. So if we count from January 3rd, 2020 to October 10th of 2022, which is just a couple of days ago, the number of cases, first of all, has been 102,580, but the confirmed cases is only, well, it's not only, it's 560 deaths, as reported by the World Health Organization. Now, comparatively, as of September 26th, how many people were fully vaccinated? Only 53.8% of the population were fully vaccinated, and only 163,631 people, which is 57%, had at least one dose. So again, not very high percentage vaccination rates. Not sure why. In comparison, United States, about 340 million people, close to 100 million people had COVID-19, which is a lot. And unfortunately, over 1 million people died from this, and there are people that are still dying, 784 deaths. So it hasn't subsided as nicely as we would have expected. There have been about four peaks in the number of new cases, and so it's on a downtrend. Actually, in about August, there was a peak again, August 10th, and then there was a rapid drop off. It seems like there's peaks from time to time. Now, let's compare this to the United States and see if we have similar peaks. So with United States, and this depends on the number of cases as well. There have not been any well-defined peaks, but January 12th had a peak, and then along June and then July there was somewhat of a peak, a flattened curve, which was something that was needed actually for the longest time. And fortunately, in September and in October, we're still falling. But even with that, there's still 784 deaths that are taking place almost every day around that, and again, over 1 million people have died in the United States. This is the breakdown by state, and you can see the number of cases and the number of deaths. I'm looking at Pennsylvania because that's where I reside, and quite a few deaths, 47,000 deaths, but nothing compared to New York. Of course, their population is much higher, 71,000. 81,000 for Florida. But these numbers are important that you contextualize in terms of per 100,000 or some sort of common unit, because otherwise you're not taking population into consideration, and so these are just numbers. From an epidemiological perspective, this does not say too much. You still can make educated guesses from some of these. And again, there you got to wonder how much underreporting there is, because there was evidence that the increase in the number of deaths actually is way higher than the million that have been reported. I wanted to introduce you to the CDC COVID Tracker as well. I know the John Hopkins one got a lot of attention, but the CDC COVID-19 cases were nice as well. Because it actually shows the current hospitalizations, and total first booster dose. So 21,000 are still hospitalized. Um, and the daily average of deaths, of course, between September and October are downtrending, but the cases are downtrending even more, which means that the deaths will start to downtrend further after the cases, because that's how they follow. Hospitalizations are also on the down. Unfortunately, the vaccinations percent with first booster dose is 35.5%. Um, so there, what types of surveillance there is? Wastewater surveillance, which is looking at the wastewater and understanding, monitoring the wastewater, and then tracking the data. So here's the information about the wastewater. So they actually measure RNA concentrations within the wastewater, and that's the virus's genetic material. And what normalization takes place is that the wastewater flow rate and the number of people served by a sewer system, and that accounts for differences. Normalization reduces excess variation and helps account for things like changing population size or weather events that can impact wastewater. So there's a normalization that takes place in the geographic area. Contributing wastewater to a sampling location is important. How does wastewater surveillance work? Well, wastewater data actually trends 4 to 6 days before those changes in trends are seen in clinical cases. This is why national wastewater surveillance system is so critical, because it's showing it's showing outbreaks without even manifestation. In many communities, this surveillance system can be implemented, because 80% of U.S. households are served by municipal wastewater collection systems. So building NWSS in your community, wastewater surveillance for the virus is a developing field. Community-based wastewater surveillance is important, and is an interesting sort of system. So here's back to the CDC page where we're looking at different contexts, also looking for health equity data, why disproportionately affected burden of COVID-19 was by marginalized individuals, cases and deaths by urban, rural status, and social factors, race, and deaths per 100,000 population by age, race, ethnicity, and sex. And you can take a look at sex here. More females seem to have just slightly higher number of cases. For here, there seemed to be a much higher female rate. Let's take a look at race and ethnicity. I think that's one of the most interesting ones. And the Hispanic population was in certain areas, especially peaks, were most severely affected. Now, American Indian and Alaska Natives were also second highest affected, then non-Hispanic blacks, and then white non-Hispanic. So this is different ways to understand health equity, vaccine distribution coverage, and then case and death demographic trends. Even though COVID is not necessarily apparent any longer, but there's still cases and deaths going on, even though downtrending. I hope this has provided you with a good synopsis over how to approach infectious diseases from epidemiological context. Thank you for listening.